doing a lot of traction and it was just making it worse for
Right.
them. Can you help me understand?
Yeah, so with thoracic outlet syndrome, like we talked about, you're going to have a negative cervical exam, positive celiac release, and Roux test.
Okay.
If you misdiagnose them as a cervical disc prolapse, when you do manual traction, you're actually tractioning and pulling on that brachial plexus, which is going to increase their symptoms and make them worse.
Got it. So it's making it worse.
Right, which is why it's so important to know the right pain generator. So what we need to do with thoracic outlet syndrome is more like open up the spaces. So for the treatment for thoracic outlet syndrome, we need to look at their first rib mobility, their SCJ, their ACJ. So we got to look at their sternoclavicular joint, acromioclavicular joint. So there's a lot of dysfunctions that go on with TOS. If the clavicle doesn't rotate correctly, it can impinge the brachial plexus every time they raise their arm. We've got to look at in-range glenohumeral joint. And then we also need to make sure that they have enough mobility in their upper thoracic spine.
Well, that's huge because all the CIs that I had basically are like, hey, if it's arm pain,
Yeah.
you just need to do traction.
Right, they just assume it's a disc.
And obviously it's not true because I'm making my patient worse. So thanks for explaining that to me.
Yeah, absolutely.